Hi, I'm Christine, and I am in my mid 40s, and I am currently in treatment for breast cancer. I would say I'm, other than the cancer, a very healthy person, and I'm also professionally a yoga therapist. And I've been using a lot of my special yoga tricks along the way. And I would say that generally I'm doing really well. And I've definitely had a lot of really difficult challenges, as everyone does, with the overwhelming nature of the whole cancer process. Um, so I thought I might make a video because I'm mid-treatment, just kind of sharing where I'm at and some of the things that have helped me along the way, in the hopes that maybe it could help someone else, especially since the percentages of women and men experiencing breast cancer are so high. So we always think, a health crisis could never be us, especially if we identify as healthy, but certainly it can affect anyone, and I'm proof of that. So just a little background on what I have. I have an estrogen receptor positive cancer, and I luckily found it on the earlier side. However, even though it was small and I was able to have it surgically removed, I do currently need chemo, and I am actually getting chemo this week. So that is something that is my current challenge. So I thought I might talk about the treatments I've had so far and some of the pretty difficult mental challenges I've had with that and emotional, as well as physical, really on all levels. And just kind of some of the ways that I've worked with myself to really kind of redefine what health means and to feel really, I feel more connected to what matters to me than maybe ever before in my life. Um, and so there's been a lot of beauty along the way. And I just thought, since this is so difficult and the dark moments are so dark, why not just shine a little light on the things that have been really silver linings in all of this that is still going on. So my treatments, I opted to have a deep flap reconstruction. So for anyone who doesn't know what that is, it basically involves removing a large portion of the abdomen, so my belly, and relocating it to the site of a mastectomy. So I had a single mastectomy, and I had pretty large breasts for my frame. Of course, as women, we have kind of this public-private relationship with our breasts, right? And so I have a long history of feelings about my own breasts and what they've meant to me in different contexts, from their arrival in puberty, like, where did these come from? I'm not sure if I like these. Okay, maybe they're fine. To, being a mom and breastfeeding, and that was very special. Really treasured time of connection for me in my life as a new mom, and really like important part of my parenting, to kind of, aging post breastfeeding and starting to get a little older. And, I believe, as my surgeon said, you have droopy breasts. So just like a statement of fact. And, I thought I was doing okay. I thought, like, all right, I've accepted my aging body and these breasts that are starting to hang low and wobble to and fro. And I'm okay with that, and like many women, one was a little bigger than the other, and that was just sort of part of my reality. And I always thought to myself, like, oh, I don't like you, bigger one. I wish you were smaller. And so when I got cancer in that, less liked breast, I thought, when I said I wanted to cut it off, like in my moments of, speaking unkindly to my body, I didn't mean it. Like, actually, I really love my breasts and I don't want to lose them. And I don't care how, imperfect they are. Like, I really actually feel literally quite attached and emotionally as well. And I was really having a very hard time with pretty much all the options available to me involved what I felt was like disfiguring myself. And I was having a really hard time with language, violent imagery, feeling violated, a lot of really, really deep, dark places in my mind and my experience mentally about what it meant to have a treatment, a surgery upon myself that was just unwanted. And it took me, really months. I was sort of waiting for that surgery. I was able to kind of help myself cope by doing breath work in particular. Was really the only thing that brought me any sense of calm and feeling centered. I also did some work in surrender-based meditations. And I can get into that maybe in a different format, what that means, but basically it's kind of the idea of letting go of control. Letting go of control is not something I like to do. I really kind of like things to be done well, and spent my life apparently being a little more controlling than I had given myself credit for or acknowledged. And it turns out, part of the trauma that we go through as a breast cancer patient is loss of control over our bodies primarily, but also you're sort of subject to the whole medical system and the treatments on really every level. You've got to sort of trust in the care that you're receiving and trust in the unknown, that somehow you're going to rise to the challenge and find a way to be okay with who you are when the outside packaging of who you are looks different. And that's a big ask. So those two things, like doing some breath work, in particular, the technique I personally use is called 4062 ratio breathing. And it can be done with or without counting, but the basic idea is breathing in for 4, not holding the breath, breathing out longer, breathing out for 6, and then pausing for 2. And it can be done with movement. My personal favorite is breathing in, doing a cow pose, and breathing out that long breath with the pause into a child's pose. So I did that for months, and it really helped to calm down my nervous system, calm down my fight or flight response, and put me into a place that I could do some surrender-based letting go meditation, which involves kind of asking myself to contact my own heart space. And I did various guided meditations that are available, for free on various apps. And then also just my own personal meditation of sitting with a sense of letting go and trusting in the innate intelligence of my body to do what it has to do to get me through and to be healthy in this other way that is maybe not external, but maybe on a deeper level. So that allowed me to sit with the unknown, sit with that fear, and really feel my feelings. So I'm not gonna lie, there were a lot of tears shed. And that's okay. Feeling our feelings is a brave act, letting ourselves be present with strong emotion, strong fear, meeting one's demons head on. Like that's not for the faint of heart. So I had done a lot of work on my mental health, specifically around controlling my anxiety prior to my cancer diagnosis for many years, to the point that I even thought, well, gee, I don't even think I have an anxiety disorder anymore. I don't have any symptoms. I'm doing really well. I'm really thriving in my mental health. So when I got my cancer diagnosis, I felt that was all at risk, that I was also going to lose my mental health. Surely I would turn into, a hermit I even at one point thought, I want to move. I'm never going to talk to anyone again. And I'm a pretty outgoing person. So that was an extreme response at those dark times. But actually, instead of the diagnosis becoming like a backtrack and destroying my mental health, it's actually in total, like if you look at the trend, not with all the roller coaster ups and downs, but the big picture, you zoom out, I really feel that it's kind of fast forwarded my evolution spiritually and mental health wise, and allowed me to really get to know myself and what I care about, to, accept, love, and support and to really be more mindful of how I spend my precious limited energy doing the things that I care about most in the world, which for me is my yoga therapy practice and my friends and my family. So I thought I would share some specific things that I did after my DIEP flap surgery and actually right prior to it that might be helpful, as well as what I'm doing right now, kind of on the cusp of the big scary C word, the chemo. Well, the other scary C word is cancer, but chemo is another scary C word. And that's where I'm at right now, is pre-chemo. So the morning of my DIEP flap surgery, the morning of my mastectomy, it was the same day. Terrifying, as if whoever's watching this is like about to get a mastectomy, and you know what I'm talking about. It's absolutely terrifying. I did the breathing. I got to the pre-operating area where you wait to, be rolled in, and I was dressed in all the things I was told to put on. And I hunkered down. I actually reclined the bed. I closed my eyes. I closed my ears, and I just focused. I put my hands on my stomach and I breathed. And I let the people caring for me know that my plan was to meditate. I didn't want to be counted down. I just wanted to go inside, and if they could respect that and allow me to care for myself in the inside, and only to interrupt me if they needed my acknowledgement or anything from me. And they were very supportive, actually. And something in that process of just like forcefully calming my nervous system allowed my inner strength to just rise up. And I don't think I've ever felt so powerful as I walk into that OR and I saw all the people, all the lights, all the equipment. And I just thought, I am saving my life right now. And I am powerful enough to get through this, and I'm okay. And it was kind of beautiful, honestly. So that helped me enormously leading up to the sort of intensity of that, what could have been seriously a traumatic, it was traumatic, but to be present in the face of trauma, I'm kind of proud of that. Like, I really helped myself meet the challenge. The next thing I wanted to share is when I woke up from the surgery. So it's a pretty extensive surgery, whether you're getting a mastectomy, delayed reconstruction, or mastectomy immediate, like either way, it's big surgery, especially DIEP flap is, you just have more surgical sites. So from the second I woke up, I couldn't breathe easily because my stomach was gone and my skin was all sewed up, so had no room there anymore. So I didn't feel I could descend my breath, or that it's even healthy to move your diaphragm and your abs at all in that case. So instead, I did moving and noticing, which is another technique. And I started with my toes. The first thing I did when I woke up after saying, how'd it go? And I was told it went fine. They wheeled me into a space, and I just started opening my toes and closing my toes, and opening my toes and closing my toes. And then I was like, okay, maybe I can do my fingers and my toes together. So I did that. And then I was like, I wonder if I can do my ankles. And that worked too. And I'm like, what about the wrists? And then, I discovered one of them kind of hurt. I was like, well, that's interesting. And then I discovered there was, some IV plugged in there. So I was like, okay, not bending that wrist, but what about the elbows? And by the time my husband came to find me and greet me and the nurses came in, I was like already mobilized. I was already, experiencing some circulation, some flow, some life force starting to rekindle. And I was already, sending lymph and all of those things that movement can support recovery and just overall optimizing of health. I was already mobilizing. And I really continued like that through all of those first days, the first week, really. And every day I gained a little ability to move more and more. Now, part of it is the necessary pain, feeling pain. Feeling pain does not mean suffering, and those are different things in the yoga tradition. I accepted and welcomed and surrendered into pain. And when I relaxed into my pain and just felt it instead of trying to avoid feeling it, it allowed me to take stock of it and to localize it and to feel present with it and to accept that experience. I was motivated not to take a ton of drugs. And I was using pain-based meditations, which I don't have time to get into right now, but maybe I'll make another video on that. But basically relaxing and surrendering into pain and then bringing your awareness outside the body. And again, kind of that idea of surrender and the practice of letting go and relaxation. And that helped me to calm when my breath felt frozen and I felt panicked by, the level of pain. It was allowed me to gain some relaxation and to allow my breath to kind of flow more naturally and to calm down. And it really did reduce my pain overall. So between moving and surrendering and relaxing into pain and accepting that experience, ultimately allowed me to have one of the most incredible meditation experiences of my life, in which I felt, by letting go into the pain, I actually felt all the love and care that was coming my way. And it was just one of the most beautiful, expansive experiences. I felt like, I was part of just this whole world of people that feel pain, that have to go through difficult medical experiences and are loved, and so I felt that love just all over the world. It sounds so cliche, and if you know me, I don't usually talk like this. But that's what the experience can do. It can bring you into the sort of edges of these slightly more woo things than we do on a day-to-day basis when we're getting stuff done and cleaning our house and going to work and all that, raising our kids. So my doctors, a couple weeks post-op were like, what are you doing? Because I've never seen anybody recover like this physically or mentally. And I just thought, I'm just moving and I'm just, breathing. And I'm just meditating and, like eating healthy and stuff, but I'm not really doing anything special. And they were like, no, you need to tell people. So that's why I wanted to do this. It worked really well to help me to accept my body, which was one of my main fears. Really, my outlook post-op has just been so much more positive, loving, and accepting towards myself than I had feared I didn't think that would happen. So if that's you, if you are facing the loss of a breast or breasts and you are devastated, that's okay. I was there too. It is devastating. But it doesn't mean you won't be able to accept your new body and to love yourself and feel that you're beautiful. And actually, our bodies are amazing. And your body is too, because all bodies are amazing. So I'm going to sort of sign off by saying what's on my mind now and what's coming for me this week. So I'm back at the beginning of the fear cycle because I have yet another big treatment that's very threatening. And I am a couple days away from chemo. It's evening right now, and I have eaten my last meal for the next 84 hours, which sounds crazy. I don't know if I'll be able to do it, but I've read about fasting and how it can be beneficial for various reasons that I'm not going to get into right now. But it's something I've decided to do for myself. And so I won't be eating for 2 days, then I'll have chemo on the 3rd day, and then I'll eat the morning of the 4th day. And I'm also going to be doing cool capping, which I've read is pretty painful and uncomfortable. I don't like to be cold. So I'm going to be icing my head, mouth, hands, and feet to try to prevent various symptoms and things from happening to me. And I'm just kind of gearing up in my mind for yet another uncomfortable, painful experience that I'm going to have to surrender into and be present with. And that's the plan. So I'm not going to lie. I am, once again, terrified. I don't want to put chemicals in my body. And I know that that's a vocabulary word that maybe isn't the most healthy. Maybe I should just be saying medicine. And that's the kind of thing the mind does. It talks to us in a way that expresses our fear. And so it is a yoga technique to view your thoughts with some sense of curiosity. So if I see my thoughts, they are definitely speaking some fearful things. But I just remind myself that, last time my thoughts did that too, and none of those stories came true. So I don't know what the future will bring, but I know that I will be bringing my present self. I will be feeling all the things I feel this week, and that's my only plan. I'm also planning to rely on the love and support of those offering it around me, my loved ones, and I'm very grateful for that. And I hope everyone has the support they need. If you are somebody that doesn't feel comfortable reaching out and accepting help, then maybe look at that, because that's a way we can love ourselves, is allowing other people to love us, and actually makes them feel good, right? So that's where I'm at. I may or may not make another video. Just one final thought on the DIEP flap recovery. I can currently stand and do a bit of a back bend, and I'm only 4 weeks post-op, so that's cool. It is possible to go from hunched over like little old lady with her walker to 4 weeks later, like back to extending one's spine, like right? Pretty cool. So don't give up, show up for yourself, and whatever your plan is, advocate for yourself. Be present with whatever you're feeling, whether it's a strong, difficult emotion or a joyful, kind of sappy one. Like, just ride those waves and believe in yourself. All right, great chatting, and I'll see you on the other side of chemo.